Hereditary angioedema, or HAE, is a debilitating and potentially life-threatening genetic disease characterized by unpredictable, recurring swelling attacks. Some patients suffer an attack almost weekly, others only a few times a year. FIRAZYR, or icatibant injection, is a bradykinin B2 receptor antagonist that is approved by the U.S. Food and Drug Administration for the treatment of HAE attacks in adults 18 years of age and older. In addition, FIRAZYR is a self-injectable, portable therapy that can be used on demand for HAE. It is important to note that given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with FIRAZYR. For additional safety information about FIRAZYR, please see the important safety information at the end of this video. HAE attacks are highly variable and may occur at any of a number of locations in the body, including the hands, feet, face, larynx, and abdomen. Cutaneous attacks typically affect the face, extremities, and genitalia, and can be disfiguring and impair function. Facial swelling is of particular concern, as it has been associated with laryngeal edema in some patients. Edema also occurs in the mucosa of the GI tract, and abdominal attacks may present with severe pain, dizziness, nausea, vomiting, and diarrhea, and may involve ascites and hypovolemia. These painful abdominal attacks may be misdiagnosed as acute abdomen and result in unnecessary surgery. And in the laryngeal area, swelling may even lead to death by asphyxiation. Clinical trials have shown that FIRAZYR is effective in treating all types of HAE attacks: cutaneous, abdominal, and laryngeal. FIRAZYR can be self-administered as soon as patients recognize the symptoms of an attack and after they have received training from a healthcare professional. The recommended dose of FIRAZYR is 30 milligrams, administered as a slow, subcutaneous injection given over at least 30 seconds into the abdominal area. Additional doses may be administered at intervals of at least 6 hours apart if response is inadequate or if symptoms recur. No more than 3 doses may be administered in any 24-hour period. The most commonly reported adverse reactions associated with FIRAZYR treatment were injection site reactions, which occurred in almost all patients, 97%, in FIRAZYR clinical trials. Injection site reactions included bruising, hematoma, burning, erythema, hypoesthesia, irritation, numbness, edema, pain, pressure sensation, pruritus, swelling, urticaria, and warmth. Other common adverse reactions included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, as well as rash, headache, and nausea. For additional safety information about FIRAZYR, please see the important safety information at the end of this video. HAE attacks can be triggered by known factors such as mechanical pressure, dental work, or stress, but attacks can also occur without an obvious cause. Bradykinin, a physiologically active peptide, plays a key role in the formation of the swelling associated with HAE. A genetic defect causes a deficiency of C1 esterase inhibitor, which leads to an overproduction of bradykinin. These increased levels of bradykinin set off a cascade of physiological effects that bring on the symptoms of an HAE attack. Now let's look at what happens on a cellular level. Under normal circumstances, blood cells and plasma flow through the blood vessels, and fluid does not pass into the surrounding tissues. The equilibrium of stream in and stream out is maintained by the endothelium. However, this is susceptible to disruption during an HAE attack. Initially, there is a marked increase in local bradykinin concentration during an acute attack. Bradykinin, reaching its receptor inserted into the membrane of the endothelial cells, binds to it and thus triggers receptor activation. The consequence of multiple receptor activation is that the linkage between endothelial cells loosens, allowing plasma content to pass into the surrounding tissue. The barrier function of the endothelial cells is neutralized, and a swelling attack is initiated. In most cases, HAE attacks are transient, progressing over 24 hours and then subsiding during the next several days. It is recommended that acute attacks be treated as soon as symptoms of an attack are recognized, given the potentially serious effects of elevated bradykinin levels. FIRAZYR has a structure that is similar to bradykinin, and it also has an affinity for the bradykinin B2 receptor. Following injection, FIRAZYR inhibits bradykinin from binding to the B2 receptor, and thereby treats the clinical symptoms of an acute, episodic attack of HAE. As a result of this inhibition, diminished receptor activation eventually allows the endothelial cell layer to close together again, thereby slowing the uncontrolled flow of fluid into the tissue. In clinical trials with FIRAZYR, there was a median time to 50% reduction from baseline symptoms, ranging from 2.0 to 2.3 hours. FIRAZYR comes in a 3 milliliter pre-filled syringe. It does not require reconstitution, dose calculation, dose titration, or refrigeration. FIRAZYR should be stored between 2 degrees and 25 degrees centigrade or 36 degrees and 77 degrees Fahrenheit, and it should not be frozen. The safety and efficacy of FIRAZYR have been evaluated in 3 controlled clinical trials and an open-label self-administration study. In the open-label phase of the 3 controlled clinical trials, 93% of HAE attacks were treated with a single dose of FIRAZYR. With FIRAZYR, patients can treat the symptoms of an HAE attack as soon as they are recognized, after training by a healthcare professional. And when using FIRAZYR, patients can be reassured that FIRAZYR was effective in clinical trials for all types of HAE attacks. Important safety information, warnings, and precautions. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately in addition to treatment with FIRAZYR. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97% in clinical trials. These injection site reactions included bruising, hematoma, burning, erythema, hypoesthesia, irritation, numbness, edema, pain, pressure sensation, pruritus, swelling, urticaria, and warmth. Other common adverse reactions included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, as well as rash, headache, and nausea. Drug interactions. FIRAZYR is a bradykinin B2 receptor antagonist and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors, where FIRAZYR may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations. FIRAZYR is classified as pregnancy category C. There are no adequate and well-controlled studies of FIRAZYR in pregnant women. FIRAZYR should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Because many drugs are excreted in human milk, caution should be exercised when FIRAZYR is administered to a nursing woman. Clinical studies of FIRAZYR included a limited number of subjects aged 65 and over. Elderly patients are likely to have increased systemic exposure. Reported clinical experience has not identified differences in efficacy and safety between elderly and younger patients. Safety and effectiveness in patients below 18 years of age have not been established. Please see full prescribing information available at this booth. To report suspected adverse events, please contact Shire Human Genetic Therapies, Inc. at 1-866-888-0660 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. For assistance with medical inquiries about FIRAZYR, please contact medical information at 1-866-888-0660 option 2 or US_ShireHGT_ medical information at shire.com. To learn more about safety related to FIRAZYR, please see full prescribing information available at this booth or call Shire at 1-866-888-0660. More information about FIRAZYR is available at www.firazyr.com.